Hawaii.
We Democrats are here on the floor to take a stand against a bill that's a disaster for our nation's health care. Medicaid patients, families with loved ones in nursing homes, people who struggle with opioid addiction, women who rely on Planned Parenthood, people who work in the healthcare industry. And so we stand with them and for them tonight. But we also stand for the American public who is being left in the dark about what Trumpcare will mean for them.
Millions of American families, and I mean millions, continue to suffer from Obamacare while congressional Democrats obstruct our efforts to rescue them. And I'll tell you, that's exactly what's happening. The Democrats have let you down, big league.
This is not the normal order of Senate business. The Republicans are going about this in a way that is so procedurally flawed that it is an embarrassment to democracy itself. They are hiding this bill. They're hiding this bill because people will be outraged when they find out what's in it. That's why a Republican aide said that they aren't releasing the bill because, quote, we aren't stupid. Think about what that statement means. First, it means they have a bill. Second, it means they think it's political suicide to make the bill public. And so they are bypassing the normal and necessary process needed to make good legislation. Have you been asked to weigh in on the policy aspects of the Senate repeal bill?
As I said, my staff has been engaged in conversations
but what about you?
With staff. I've had conversations with members of the Senate about what kinds of things we believe need to be done to make certain that individuals have access to the highest quality care.
And what's your understanding of the status of the bill? Just process-wise, where we are in the because you may have some insight that Democrats don't have. As you know, there is a 13-person group of men, not the Help Committee, not the Appropriations Subcommittee on Labor HHS, not the leadership, just 13 men literally meeting in secret, talking about what to do with around 1/6 of the economy. So are you participating in those conversations personally, either sort of serially, consecutive conversations, informally over breakfast and coffee? What is your level of participation in those conversations?
My knowledge about those conversations specifically is what your knowledge is, and that is what you read in the newspaper when you get up in the morning. I understand that the leader's goal is to have a bill come through the Senate by the 4th of July or shortly thereafter.
I'm sorry, but the question is, are you talking to any of those members in that 13-person group of men?
Well, I couldn't tell you who the 13 people are, but I talk to senators all the time about health care issues, and many of them have questions.
The way you make legislation is you allow the sun to shine in, and that starts with hearings. Every legislative body in the country, from a school board to a county council, has hearings, because we figured out that for all of our flaws, we figured out that over the centuries that you need hearings, not just to placate the masses, but to figure out whether your legislation is any good or not. Republicans have not held a single hearing on Trumpcare. No one who knows anything about health care is allowed to say anything about this bill because they aren't even allowed to see it. But anyone who's ever tried to understand the American health care system knows that it's complicated. The president said so himself.
It's an unbelievably complex subject. Nobody knew that health care could be so complicated.
You need expert testimony, you need public input, and you need time to talk to your home state. That's the way you get a good product. But Republicans have totally bypassed the two committees that exist to consider legislation like this. Think about it. Under normal circumstances, this legislation would be in the Finance and Help Committee jurisdiction. There would be hearings and there would be a markup. But that's not the process that's being used. There's no markup, there are no committee hearings, it's just 13 dudes. And they are rushing to pass a bill without women, without Democrats, and without input from the American people. Do you think that that 13-person group would benefit from the perspective of a woman?
As I said to another question that was asked, as a member of the Article 2 branch of the government, I will leave the Article 1 branch functioning to the Article 1 branch.
You can't answer the question of whether you think a health care discussion would benefit from having a woman involved or not?
As I say, this is an internal issue for the legislative branch, for the Senate of the United States. And
here's the order of the people who get to see the health care bill. 13 men in secret, Republican lobbyists, Politico, Republicans, Democrats, and then the American people. This is shameful. This is a violation of the way democracy itself should work. When they are done, the product will be the fruit from a poisonous tree. It can't be good because the process that produced it was so flawed.
No matter how good it is, we will get no obstructionist Democrat votes. No matter how good it is, if it's the greatest health care plan ever devised, we will get 0 votes by the obstructionists, the Democrats. It's time to give American families quality, reliable, affordable health care, and that's what we are working very hard to do, and we'll get it done.
There are many, many Americans who don't support this bill, and I'm going to highlight 3 groups who stand to lose. First, you have people who are going to pay more for insurance, lose their insurance altogether, or lose the ability to choose their provider. Families won't be able to afford nursing home care for their loved ones or pay the hospital bills for a parent after she has a heart attack. Americans with pre-existing conditions will struggle to buy insurance because insurance companies will be able to charge more for conditions like diabetes or cancer or asthma. Women will be blocked from getting annual checkups or cancer screenings at their local Planned Parenthood clinic. All of these people stand to lose if the bill moves forward. Second, you have people whose jobs may be at risk. Healthcare makes up about 1/6 of the American economy, and it doesn't exist in a vacuum. This is an industry that impacts millions of workers, and you can bet those jobs will be affected by this bill. One study found that Trumpcare will take away nearly 1 million jobs by the year 2026. We're supposed to be helping American workers, not taking away their jobs or making it harder for them to get health care. Finally, this bill hurts the working poor. These are the people who will struggle even more under Trumpcare, and I don't know why we would punish them. Why would we leave them with nowhere to turn? I know that millions of Americans feel the same way that I do. They care deeply about the poor, the vulnerable, and the sick among us, because they've made news standing up for their neighbors. One woman named Jessie went to a town hall to make her voice heard on Trumpcare, and I want to read what she said, and I quote, "It's my understanding that the ACA mandate requires everybody to have insurance because the healthy people pull up the sick people, right? And as a Christian, my whole philosophy on life is pull up the unfortunate. So the individual mandate, that's what it does. The healthy people pull up the sick people. If we take those people and put them in a high-risk insurance pool, they're costlier and there's less coverage for them. That's the way it's been in the past, and that's the way it will be again. So we're effectively punishing our sickest people." And I end the quote. Look, we may not agree on policy, but I hope we can agree on the process. So what will it take? What will it take for this process to be restored and for Trumpcare to be considered in the way that it ought to be considered? The answer is actually very straightforward. We need 3 Republicans. It only takes 3 Republicans, and you can be a person who hates the Affordable Care Act or has mixed feelings about the Affordable Care Act or anywhere in between. It only takes 3 Republicans at the United States Senate to restore the United States Senate itself, to restore the hearing process, to restore public confidence and restore bipartisanship. All we need are 3 Republican senators to say, I won't vote for anything if there hasn't been a public hearing. I won't vote for anything that's being jammed down America's throats. I won't vote for anything without being able to go back home and figure out how it will impact my state's hospitals. This is not an unreasonable ask. We're just asking for 3 Republicans to say, let's be a Senate again. Let's restore order and transparency and do things the right way, because that's the only way that this bill will not be a total disaster. How many days do you think is a reasonable number of either legislative days or calendar days for you and your staff to be able to review a bill to determine what your position is on the legislation in terms of the department? How many days do you think you need for a bill of this magnitude to be able to kind of metabolize it and opine on it?
Well, if I take my secretary hat off and put on my congressional hat that I had on for 12 years, I can tell you how many days I had for the ACA, and that was about 2.
How many days do you think you needed?
And that was not enough for a 2,500-page bill.
How many days do you think is reasonable for the department to be able to come to a conclusion about any piece of legislation?
For the department to come to a conclusion?
Yeah, for the department.
Well, the department is engaged, and from a technical assistance standpoint, it's not the department's role.
On an ongoing basis, right?
Sure, on all sorts of issues.
Right, so I guess the question becomes, if we were to present, say the Democrats were in charge and we were going to present you with a bill that you hadn't read, that you had only heard about through sort of open source reporting, how many days do you think you would need to process that bill and to come to a policy conclusion about it?
Well, I look forward to a bill coming from the Democrats to suggest how we improve the health care system.
We're not going back and forth sort of rhetorically. I'm just asking you how many days you think.
It would vary on what the topic was and how complicated the issue was.
Right, but we're talking about this issue. So it is complicated. You're very intimately familiar with how complicated it is. You're in charge of the department. How many days do you think you need to process a bill?
That's a hypothetical, and it's a not answerable question.
Thank you.
The senator from Hawaii.
Thank you, Mr. President. I'd like to give a status report on this bill. Right now, we think it's with the 13 men who are working on it in secret. They will show it to Republican lobbyists, and then they will send it over to the CBO for a score, and eventually the American public and the Senate will be able to see the bill. And we will have a process called Vote-A-Rama, which is mostly nonsense. And there will be lots of opportunities to offer amendments, but let's be clear what happens at the end of Vote-A-Rama. The leader will offer an amendment in the nature of a substitute. So what does that mean? That means that all of the amendments that were adopted along the way get taken out with 151 vote margin, and all of that Vote-A-Rama was for show because Mitch McConnell will put his bill on the floor that was negotiated in secret with those 13 people. If there was any question that our democracy is being rolled over by Senate Republicans, I want you to think about these 13 men. They are drafting a bill without any input from women, from Democrats, from experts, and by working in secret, they are cutting out about 250 million people who are from the 40 states who aren't represented among those 13 men. And you can bet that those 40 states have unique health care needs and unique health care laws. And without the right language, the bill could throw health care in each of those states or any of those states into total chaos. They've also cut out senators on the Health, Education, Labor, and Pensions Committee and the Finance Committee, even though these committees are actually constructed for the purpose of working on legislation like this. They know how to get things done like this. There are members of the Help Committee and the Finance Committee that are among the experts on this issue, and yet they don't get a chance to even see the bill. These senators have jurisdiction over this legislation, but they're being left out. And this is just not the way it's supposed to work. We need transparency, we need bipartisanship, but now the Republicans will try to tell you that, hearings are bypassed all the time. That's not true. That's not true. In fact, this body will hold a hearing on almost anything. In 2017 alone, the Senate has had hearings on hot tub safety, self-driving cars, a treaty for outer space, multimodal shipping, and the Maritime Administration, and dozens of other issues. Look, those are actually not to be trivialized. It is important for the Senate to have hearings. It's important for subcommittees to do their work. But nobody can tell me that hot tub safety, self-driving cars, a treaty for outer space, multimodal shipping, the Maritime Administration are more important than 1/6 of the American economy. It's a joke. We're talking about 1/6 of the American economy, about millions of jobs, and people with life-threatening diseases and life-changing medical bills. And so we know how important hearings are to do legislation. When the Senate took up ACA, there were almost 100 hearings. Think about that, 100 hearings versus 0. There were roundtables, there were walkthroughs held by the two committees. We considered hundreds of amendments and accepted more than 150 amendments from Republicans. But for this bill, no markup, no transparency, no bipartisanship, just 13 men meeting in secret outside of the regular process. And the only thing that has changed is now the market is under siege, but the market is under siege because
It was just announced
of the Republican administration.
that 2 million people have dropped out of Obamacare, 2 million additional. They're leaving fast. Premiums have increased by an average of more than 100% nationwide. In North Carolina, premiums have gone up 176%. In Arkansas, premiums have gone up 128%. In Pennsylvania, premiums have gone up by 120%. And I hate to say this to you, Lisa, but in Alaska, they've gone up 207% on Obamacare. You know, I used to mention only Arizona because they were up 116% in Arizona. Now Arizona is like good by comparison to some of the numbers, but they're way up in Arizona also. Insurers are fleeing the market. Last week it was announced that one of the largest insurers is pulling out of Ohio, great state of Ohio. That could mean another 20 counties, at least 19,000 people in Ohio will have no plan at all.
They are purposefully creating uncertainty, and that's not a rhetorical flourish. They're saying they're doing that. President Trump actually said he wanted to create uncertainty in the healthcare market in order to create leverage with Democrats. Think about how unusual that is. Think about how offensive that is. It is perfectly appropriate for one party to try to generate leverage in a negotiation against the other. That's part of politics, either in an election context or in the public policy context. But the way that this president and Tom Price are trying to generate leverage is by raising health care premiums in order to force Democrats to buckle. That's unheard of. It really is unheard of. And it hurts everybody across the country to create this uncertainty.
Obamacare has been broken, and it's been a broken promise. One after another, Americans were told that if you liked your doctor, you'll keep your doctor. That was a lie. They were told that if you liked your plan, you'd keep your plan. That was a lie. Americans were told the premiums would go down by $2,500 per year, and instead their premiums went up to levels that nobody thought even possible.
It's bad enough that the Republicans are trying to take health care away from 23 million people, from nursing home patients and their families, from women who are pregnant or fighting breast cancer, from sons and daughters and moms and dads who struggle with opioids. But to add insult to injury, they're going to jam it down your throat. You don't get to read what it's about before it passes, or hear from doctors or nurses or experts about how it will affect you. So why are they working on this bill in secret? And the answer is very simple. The bill stinks. They're ashamed of it. The bill itself is an embarrassment. The process is an embarrassment. They've said so themselves. No matter how you look at this bill is a disaster for people and their families. It will be a disaster for anyone who relies on Medicaid, which will be cut by at least $800 billion. And Medicaid is a safety net for people who need care but can't afford it. Look at nursing home care. Medicaid covers 3 out of every 4 long-stay nursing home residents. Medicaid covers 3 out of 4 long-stay nursing home residents. And my wife's grandmother was just in a nursing home and just passed away and had great care and wouldn't have been able to get the care that she needed were it not for Medicaid. And this is not an uncommon story. These are millions of Americans across the country, by the way, of all income levels. People think of Medicaid as people who are financially not in a position to get care in any given moment. That's true. It does take care of the poor, but it also takes care of nursing home care for people who worked all their lives and just don't have enough. It's $9,000 a month in the state of Hawaii for nursing home care. It's more than that for hospice care. We all know nobody escapes end-of-life care. Rich or poor, left or right, red, blue, purple, nobody escapes this part of your life. And everybody needs help. There might be a few people who save up enough cash money to be able to shell out $10,000 a month for that kind of care. But for the rest of us, Medicaid is that lifeline. There are actually some Republicans who don't want to cut Medicaid. They've seen how the program improves people's lives. Arkansas, Kentucky, for example, they expanded Medicaid. These states have seen big jumps in the number of people who now have their own doctor or have gotten a checkup in the past year. People who are now more likely to say that they're in excellent health. But under Trumpcare, we'll be back to the bad old days. This bill is also a disaster for older people who will be hit with what the AARP is calling an age tax. And this will get a little wonky, not as wonky as my colleague who spoke about 5 minutes ago, but a little wonky. Right now, companies are not allowed to charge any more than 3 times as much for an older person as a younger person. 3 times is the cap. But Trumpcare will increase that rate to 5 times. And so what happens is every year as you get older, your insurance costs will go up and up and up and up. That's why they call it an age tax. In other words, many seniors will see premium increases that could cost them thousands of dollars more each year at a time when people are already struggling to find the money to pay for health care. This is also a disaster for patients who don't want to lose their health care provider. Right now, an estimated 1 in 5 women go to Planned Parenthood clinics. And I understand that we have different views about reproductive choice. I understand that. But we also understand, when we're talking on the level about Planned Parenthood, and we're talking about the federal funding for Planned Parenthood, everybody who pays any bit of attention to this understands what Planned Parenthood does for women across the country. Again, conservative women, progressive women. Planned Parenthood doesn't care. And Planned Parenthood is not using federal funding for abortion. We all know that by now. It's cancer screenings, it's quality health care, and birth control. People talk about giving more choices for health care and saving taxpayers money, but the CBO estimates that defunding Planned Parenthood will take away options for nearly 400,000 women across the country, and it will cost taxpayers more than $130 million. It's also a disaster for those who are struggling with opioid addiction. This bill will take away treatment for mental health and addiction, leaving hundreds of thousands of people fighting opioid addiction without adequate health insurance. We saw the statistics that opioid addiction, I believe, is killing more people annually than HIV/AIDS killed at its apex. I believe it has either surpassed or is comparable in terms of the cause of death with car accidents. This is one of the leading killers in the country. And Medicaid is the program that funds opioid addiction for most of the people who get help. This bill is also a disaster for patients with pre-existing conditions because it means we're going to go back to the dark days when insurance companies could charge you more for having a pre-existing condition. I've heard from people back home in Hawaii who are terrified of what this could mean for their health. One woman wrote that she's in the middle of a fight for her life against breast cancer. And she's scared that under Trumpcare, she will lose her insurance. She'll have to stop her treatments, and she could lose her life. A husband wrote to me that his wife has stage 4 breast cancer. She's had every possible treatment and surgery imaginable to extend her life, but without the guarantee of affordable coverage for all, her fight will quickly come to an end. She's 29. Even people without serious medical conditions will be affected by this pre-existing conditions nonsense, and we know that because before the Affordable Care Act became law, insurance companies were able to discriminate based on what they determined to be a pre-existing condition. One woman in Hawaii told me that in the days before the Affordable Care Act, she was rejected by insurance companies because she had back pain at one point in her life. The pain never came back, and she never needed treatment again. And she was young and healthy, but the insurance company wouldn't give her insurance. We cannot accept the end of nationwide protections for people with pre-existing conditions. We cannot accept high premiums or so-called high-risk pools that have historically failed in giving people the coverage that they need and they deserve. Look, we don't have to do it this way. We don't have the majority, and this is being done under a process called reconciliation, which means that you don't need a filibuster-proof majority, you just need 51 votes. So if you're proud of your bill, you've got Senator Hatch, he's the chairman of the Finance Committee, one of the most respected Republicans in the country, actually. You've got Senator Alexander, likewise, the chairman of the Health, Education, Labor, and Pensions Committee. Both of them have a long history of being able to do deals. Orrin Hatch with Teddy Kennedy and my predecessor, Danny Noy. Lamar Alexander with just about everybody, Chuck Schumer, Patty Murray. I mean, these are conservative members of the Senate, no doubt about their Republican credentials, but they're also people who are capable of crafting legislation in the right way. And I have no doubt that they like their gavels. I have no doubt that they like chairing hearings. And I have no doubt that they have the personal, intellectual, emotional, political stamina to go through a process that may take more than a couple of days. And I'll tell you, this is the world's greatest deliberative body. It is. And this is a bunch of impressive people who I serve with in the United States Senate. But you know what? Without a hearing, you get a garbage product. You get a bill that just stinks, that staffers say that they are keeping secret because, quote, we're not stupid. They are so embarrassed at this product that they are keeping it secret because they know the moment this thing gets posted, everybody from everybody's home state, and not just Democratic states and not just purple states, but every home state is going to say, my community health center is going to get shut down. Wait a second, my opioid treatment program is going to get shut down. My hospital may no longer exist. They know this bill stinks. And there is a simple solution. All we need is 3 Republicans to say, let the Senate be the Senate. House did whatever the House was going to do. There was a weird White House Rose Garden signing ceremony without a bill even being enacted. It was the most bizarre thing I've ever seen, where everybody was congratulating each other for inflicting pain on the American people. But the Senate has to be the Senate here. And what that means is that we have to be that cooling saucer, right? We have to actually slow down and have a deliberative process. And all we need is 3 members of the United States Senate on the Republican side to say a very simple thing. And they can be as critical of Obamacare as they want. They can be as partisan against us as they want. But all they have to say is this: I'm not voting for a bill that doesn't get a hearing. I'm not voting for a bill that doesn't get a hearing. Let this thing see the light of day. I yield the floor.